Tzu Chi volunteers continue to visit Malawi to deliver secondhand clothes and other goods to seniors. COVID-19 increases demand for hospital beds in Malaysia. Tzu Chi volunteers help convert leprosy ward. I'm Sean Scanlon. This is DI Headlines. Tzu Chi volunteers went to Malawi for the 7th time. They collected secondhand clothes and personally delivered them to those in need, planting seeds of goodness in Malawi.
We are in a forest of love. We have to enjoy with that fruits. We have to go forward so that we can activate a lot of volunteers to join.
Tzu Chi volunteers from Durban, South Africa, came a long way to Chicago tribe. They greeted the visitors with song. The other tribe chief also came to share.
The way we go there, we were learning about patience and love. If someone is sick, we need to take care of him.
Tzu Chi in Malawi represents love and care. In front of this red brick church, it shows Tzu Chi operates regardless of tribe and religion. Tzu Chi people walk into the community, visited the poor, seniors, and bend over to deliver corn flour, which convey warmth.
When I was 15 years, I always buy food for her, clothes, and soap or even sugar to help her. I was doing a peace work so that I can get money to help the old people like this.
Aninavi went to all tribes and used what Tzu Chi volunteers told her about respect and directness to encourage more people to join the ranks of love.
Learned about love and that we should love our neighbors and we should love other people as well who are suffering.
People in all our societies, we are the one, and we have shown the true love that we have to share to each other.
Senior volunteers from Durban, South Africa spread their love across the country. They use actions to demonstrate, passing on the Tzu Chi spirit generation after generation. With the vast territory of Africa, how to extend their footprint of love, as this big family also shows compassion and mutual understanding.
The island of Sulawesi in Indonesia was devastated by a strong earthquake and also a tsunami in September of 2018. Tzu Chi later built Great Love villages in Palu. The first 550 houses were completed. The second group of 600 people came to pick their door numbers.
Yang berkekuatan itu cucu sudah tekad saya akan pelihara. Itu saja yang beri semangat saya hidup. Keempat cucu saya.
1.5 years after the strong earthquake hit Sulawesi, Indonesia, the first Tzu Chi Great Love village in Palu is almost completed. The second group of survivors came to sign the moving contracts.
The Great Love Village is given to the survivors in the serious disaster areas near the shores, so we will make sure their identities and the locations of their original houses.
The survivors pick their house numbers by lottery.
589 families came to report to us, so we used the lottery to decide their house numbers. Then the mayor will issue the decree, and after obtaining the housing certificates from the government, the superior will have to do the final approval.
Their houses are coming into shape, their hands are holding the lucky numbers, and their new lives will soon begin.
To help flatten the epidemic curve, the government of Paraguay has urged people to stay home. To help seniors battle the epidemic and accumulate daily supplies, Tzu Chi volunteers carry out regular distributions at a local nursing home.
COVID-19 is spreading around the world. There are over 10 confirmed cases in Paraguay, and the dengue fever is also spreading. So on this day of distribution, Tzu Chi volunteers also give out mask covers and mosquito repellent plants.
I really appreciate Tzu Chi has been helping us. In addition to the food basket, we also received mosquito repellent plants and blast covers. I want to thank the volunteers for caring about us.
The mask covers were made by volunteers. Many people do not know how to use it, so the volunteers explained to them.
Tzu Chi Foundation has been helping me for 2 years, so through Tzu Chi's help, my family is able to live better, and we don't have to worry about having no money to buy milk and medicines. Thank you, volunteers.
I have one special kid to look after. Every time I can pick up 2 cans of milk powder and 2 bags of diapers. Thank you, Tzu Chi, for helping us, so I have no worries.
To stop the virus from spreading, the government of Paraguay asked people to stay at home. A nursing home that Tzu Chi has been carrying asked Tzu Chi for aid supplies, so volunteers bring them goods immediately.
I am thankful to Tzu Chi volunteers for sending over these medicines, food and vegetables, because we need these goods every day. Thank you for your help.
Volunteers cancel their happy hours with these seniors. They look forward to the warm sense of love once the epidemic is over.
In China, Tzu Chi has helped 3 Tibetan youth receive treatment for their severe scoliosis. Thankfully, this medical assistance has not been interrupted by COVID-19. However, hospital quarantine rules mean that volunteers and even the patient's family members cannot visit the hospital.
Due to COVID-19, the hospitals in Sichuan's Chengdu are restricting visitors. But that doesn't stop those who make an effort. 3 Tibetan youths who are on a video call with Tzu Chi volunteers are all suffering from scoliosis. Tzu Chi has assisted in treating their health issue. Now, despite the outbreak, their treatment continues. Tibetan youth Nima's father has been isolated in his apartment for 3 weeks due to the hospital's quarantine measures.
The dad says in these 20-some days, he is unable to visit his child in the hospital and could only stay in this room isolated from everyone. Sometimes it's very cold to where his legs were hurt and his back would be in pain. When I heard, I was very moved as to how much love he had for his child. It was also heartbreaking to hear.
The bed is next to the window where there is nothing blocking out the draft. Thus, volunteers quickly installed a shield. Though unable to enter the hospital, the volunteers are still able to pass forward their love through the nutritional soup they made for the family, as well as waiting for an appearance.
You find out that sometimes words are not needed to express your feelings towards someone. Sometimes it's felt in the heart. We definitely felt the children's love for us.
The COVID-19 epidemic in Malaysia continues to spread as local hospitals require additional wards. 60 Tzu Chi volunteers were mobilized to help a hospital convert 11 vacant leprosy wards. The cleaning work that would originally take 1 week to complete was finished in only 3 hours.
Standing 1 meter apart from each other, Tzu Chi volunteers did well in self-prevention and prepared to clean the walls.
You have to protect yourself. Everybody here should wear masks and gloves. After putting on gloves, please don't take them off, because once you take them off, you will easily contaminate your hands.
The COVID-19 epidemic in Malaysia is raging, and the number of isolated patients continues to increase. Hospital Sungai Buloh urgently needs to add more wards to meet the demand. The place I'm standing right now is Hospital Sungai Buloh. 60 Tzu Chi volunteers in Selayang and Kuala Lumpur are mobilized to clean the walls. The hospital is going to transfer the COVID-19 patients here.
Thank you so much, all of you, for coming together and helping us.
My staffs will understand that they are getting support not only from the hospital and Ministry of Health, but also from the community, the NGOs coming together to help in this fight against COVID-19.
5 people in a group work together to clear a total of 11 vacant wards, which were originally used for leprosy patients in the morning.
Every time when I saw medical personnel saving lives in the front line, I was very touched. I'm very grateful for having this opportunity to give up.
I can contribute my little to help those medical personnel and the country.
We hope that the patients staying in this ward would recover faster than others, because here has love from our Tzu Chi volunteers.
I can only say thank you. I mean, I've lost for words. Basically, a week worth of work, actually cleansing works, and you guys done it in what, 2-3 hours?
Under the COVID-19 epidemic, it is hoped that everybody can unite together to pass through this epidemic crisis.
In order to thank team members for their efforts during the coronavirus outbreak, Singapore Tzu Chi volunteers prepared 145 care packages and sent them to the hospitals and clinics to cheer up medical staff.
During the current epidemic, medical staff are prohibited from going to different medical sites to avoid cross-infection. Therefore, team members cannot participate in Tzu Chi free clinic. Be that as it may, Tzu Chi executive team and volunteers didn't forget them, as 145 care packages were delivered personally to hospitals and clinics to cheer team members up.
This is very meaningful. I feel full of energy now.
I think very touched, because as always, Tzu Chi will show its concern and will always be appreciative to those who help others. And I think that's Tzu Chi's way.
A member of the delivery team, Lisa Chong, who is a retired nurse, fully understands the medical staff's sentiment.
We were very busy during SARS every day. Everybody was panicked because some people died at the time. So many people were reluctant to see medical staff because they might be carriers. We have to send our love to team members. This love is like a wave which ripples continuously.
During this outbreak, let us send out our love to safeguard everybody, fighting the epidemic together.
During the epidemic, Hangzhou Tzu Chi volunteer Xu Hongying does her best to deliver daily supplies and cook hot meals for people in her community. In addition, she even cleans the public garbage bins. Her efforts have touched local residents and created a cycle of love.
只有爱才能消除恐惧啊！恐惧消除了，那我们有了正念，有了正气，自然就是一个心理的防御。
During the epidemic time, the residential committee delivers daily supplies to each household. Hangzhou Tzu Chi volunteer Xu Hongying inspires other people by her actions. She will even clean the public garbage bins.
For the past 2 days, Teacher Xu has cleaned the garbage bins. The residents have stopped being angry. Since the foul odor is gone, they have nothing to say. You really touch me as you are sincere. Therefore, if you want me to do something in the future, I feel that is my responsibility.
The volunteers' words in action match take preventative measures against the virus with love.
It's a net that needs to be weaved with lots of lines. These lines are volunteers and family members. They also include the community residents and government officials. Everyone has to work together.
The net started with her home.
As long as I can calmly and joyfully lead the children to play these games and then influence my family, I have transformed my negative emotions.
She has uploaded the real heartwarming stories onto her social network. 500 households immediately feel the influence of the social networking media.
Seeing other people making donations, I also want to make donations. So epidemic prevention supplies keep coming. Everyone is being grateful to others.
The residents start to donate daily supplies and deliver hot meals to the security guard posts in the small community.
The volunteers feel that helping out is worthwhile. We feel warm at heart. I think the people have started to appreciate each other.
Despite the epidemic, the volunteers' love and care have warmed up the hearts of the residents.
In 2003, SARS helped Taiwan gain a wealth of experience in epidemic prevention work, as well as establish an overall command structure. This has helped frontline medical staff and the public face an invisible virus.
The case 34 was passed on to a nursing colleague. This is considered to be a hospital infection.
Epidemic prevention measures at medical institutions include all visitors must first disinfect their hands when entering the hospital. The most important thing is washing their hands with alcohol before entering the door and putting on a mask, then entering the hospital for infrared temperature detection camera.
For the first time, for more accurate travel history before entering Hualien Tzu Chi Hospital for March 3rd, one must swipe your health insurance card at the door. In order to reduce the risk of infection, people with fever will be directed to the emergency room, where there is the nation's first negative pressure collection and inspection station, open on February 24th. The design of the negative pressure room is mainly to reduce the risk of cross-infection between medical staff and the public. All tests, including blood, urine tests, chest x-rays, and new coronavirus testing, are done here in one stop.
This is a HEPA filter which is put into use, taking out the air from this chamber, so the room is actually a negative pressure room.
People who are suspected to be infected with coronavirus will be placed in such a negative pressure wards after the first test. They must wait for the test result to see if it is negative or positive before receiving follow-up medical treatment.
In general terms, the ventilation's effect is like sucking contaminated air outdoors. If a sick person breathes out dirty air here, it will be sucked out.
Each negative pressure isolation ward has two doors. As soon as it is open, the inner air pressure will change. A scale above the doorway will indicate whether the air pressure in the ward is maintained within a normal value of -8 PA. And when frontline nurses go in to take care of patients, they must also wear waterproof isolation clothing. Every time you come in and out of a ward, you have to change this protective clothing, put on a new set to enter another ward. Putting on and taking off this protective clothing is full of challenges.
When there were only 1 or 2 confirmed cases abroad, we first began to do education and training. According to our experience with SARS and MERS and other coronavirus to come, we will have to take all necessary precautions.
Establishing a transparent information system and a standard epidemic prevention process has helped medical staff prevent the spread of the epidemic. Furthermore, medical staff everywhere are on standby 24 hours a day.
那你是一个病人几岁？小孩子当然，那就给他裁剪了。是这个新型的冠状
This new coronavirus disease is actually quite difficult to treat. The first thing we do is to notify the person about the status. What we mean about notifying a person is that the patient needs to go into a negative pressure isolation room and submit to quarantine and do testing.
Negative pressure isolation wards are an indispensable piece of medical equipment for epidemic prevention. Comparing the ratio of such rooms to the population should comfort the public. For example, Japan's population is 5 times that of Taiwan, but there are only 1,800 negative pressure isolation rooms, which is less than twice the number in Taiwan. The reason why Taiwan's epidemic prevention preparations can reassure the people is the experience of SARS 17 years ago.
At that time, some supplies for epidemic prevention were really not enough, so our negative pressure isolation wards were probably built at that time. In fact, many of our doctors were involved in battling SARS. We have actual experience, and our preparation is actually better than that year.
After SARS, the Legislative Yuan revised the law on infection disease control. We raised the authority CDC, which is under the Ministry of Health and Welfare. Now it plays a coordinating role to manage Taiwan's entire epidemic prevention system.
With this new authority, epidemic prevention work can be made more disciplined.
The Infectious Disease Control Law contains provisions for the establishment of the Epidemic Prevention Command Center. With such a command system in place, everyone follows the commands of this center as everyone works together.
In the 17 years since SARS, Taiwan's epidemic prevention system has been fully upgraded. The government not only requires major hospitals to regularly organize infectious disease control drills, but also requires that there must be at least 1 month's inventory of epidemic prevention supplies. This is why, regardless of whether it is H1N1, MERS, or coronavirus, Taiwan can be safe during this crisis period. Under the protective care of the public health system, Taiwan will definitely be able to weather this health storm. As COVID-19 virus spreads globally, medical professionals on the front lines need protective gear. Besides the well-known N95 mask, what other protective gear is there? Let's find out in our next report.
Whether they're collecting specimens or going to the wards to care for the novel coronavirus patients, medical professionals must wear protective gear. Besides N95 masks, they also have to wear isolation gowns or protective clothing that is blood and virus resistant.
It is a disposable jumpsuit, or the famous bunny suit. This is to be worn inside. Outside, there is a disposable water-resistant isolation gown.
Since they might touch the patients, they must wear gloves. Protection is also needed for the face and head.
We need to complete facial shield that covers the eyes and hair. When you wear a water-resistant isolation gown, your hair is outside, so it is necessary to wear a cap.
Lastly, they need shoe covers so they won't come into contact with the virus on the ground. The protective gear enables the medical professionals to serve patients without worries.
A fire in the early morning of March 14th burned down several apartments in Wanhua, killing 6 people and sending 9 to the hospital. Tzu Chi volunteers send blessings to survivors and help them through this difficult time. We'll leave you with this. Goodbye.